Hello, I'm Dr. George and welcome to Conversations. Today we have with us Dr. Robert Zettle. Dr. Zettle is the Director of Clinical Training in the Department of Psychology at Wichita State University, Kansas, America. He also runs the Cognitive Behavioral Science Lab in the university. Dr. Zettle has published a lot of researches in the most prestigious journals there is, and those has helped contextual behavioral science to gain an empirical foundation. His book, Act for Depression, a clinician's guide for using acceptance and commitment therapy in treating depression, is regarded as a textbook when it comes to therapeutic interventions for depression. Today, we're going to talk with Dr. Zettle on depression. Dr. Zettle, welcome to the conversation. It's a great pleasure and privilege to have you with us today. Most of the people who are going to watch this video may not be, familiar with this word contextual behavioral science, So I think let's start there. What is contextual behavioral science and how does it help when it comes to understanding mental health and abnormality a little more better?
Well, it's kind of a fancy term, but it's pretty basic. Really, all it suggests is when we're trying to understand the human experience, that it's useful to take into account our individual histories. So all of us bring an individual learning history into a current situation. We don't lose things that we've learned as part of our history while growing up.
Yeah.
So basically, the premise is at any point in time, really how we're experiencing something, behaving, reacting to our circumstances is not just due to those present circumstances, but also the history that we bring with us to those circumstances.
So it's
in a nutshell, that's it. Really pretty simple.
So seeing every behavior in a context.
Right, in historical context, what's your history and what's the current context, the current situation. Mm-hmm. So kind of the notion is that what you're experiencing at any given moment is really a combination of what's going on in that particular situation. And again, the learning history that you bring to that situation. Mm-hmm. So you're likely to respond to a current situation in a way similar to how maybe you've dealt with like situations in the past. That's part of your learning history.
So, so when we are looking at depression from that angle, how will we make sense of depression or understand depression?
Well, again, I think it would be a matter of what's going on in the current situation and what's your history, let's say, with respect to depression. So certain depressive feelings, sadness, sorrow, grief, hopelessness, helplessness, a lot of the emotions that we normally associate with depression may be triggered by certain factors in your current situation. There may be reminders, there may be cues. You may encounter something that reminds you. So for example, hearing a song playing in the background, and gee, maybe that was a song that was the favorite of maybe a best friend or a family member. And then you immediately think of them and perhaps find yourself grieving their loss. So simply hearing that sound, that song triggers memories of the lost loved one or friend, and then you find yourself re-experiencing perhaps that sense of loss. So it's really a combination of what your history is and what's going on in that situation that may elicit certain kind of emotional reactions. And they're almost inevitable. It's not something that we can control. It's just when you're in that situation and given your learning history, it's natural to expect that that's probably how you're going to find yourself reacting emotionally.
Mm-hmm. So so this is just an event eliciting the response. But when it comes to clinical depression, is it the same thing or clinical depression as
well,
developing as a disorder?
Yes and no. you can certainly make a distinction, and you can, go to diagnostic manuals and other kinds of materials to try and make diagnoses of depression. But I think it's more useful to think about what we call depression as just part of the normal human experience. That the perspective that contextual behavioral science tends to take is there's kind of a continuum. And so there's not a clear dividing line between the kinds of emotional experiences perhaps that people who are not diagnosed with depression experience from those who are. It's all part of the human experience. And I think it's more useful to view individuals who may be struggling with what we call clinical depression as just having a more difficult time dealing with some of the same emotional reactions we probably all experience that are just an inevitable part of being a human being, that it's inevitable we're going to experience sadness and sorrow. Some of us will experience that to a much greater degree, and some of us have more difficult times in how we respond to that, in managing it. But I think the genesis for people who are struggling with what we might regard as clinical depression oftentimes is not any fundamentally different than what we all experience.
So so when you're saying that, how much should we rely on this diagnostic manuals? Because if it is a normal, situation, and if it is a normal process, then, how much will it be helpful if you rely so much on the symptoms and the so-called 10 symptoms for 2 weeks and things like that?
Yeah, well, in my view, too much. Now I realize it may be necessary in some situations to be eligible for services, or in certain delivery systems have third-party payers or insurance, or have coverage of services you're going to receive. So I realize that's necessary, but I think in terms of thinking about how to be responsive to people who are experiencing some emotional suffering, I'm not sure it's terribly helpful. At least in my own personal experience, I don't think it doesn't add a lot to my understanding of a client in most situations to know, gee, whether or not this diagnosis or that diagnosis, if we're viewing it according to a manual, is more appropriate or less appropriate. I think what's more relevant is what's their human experience like, and how does their experience, how can I relate my own experience to theirs? So what concerns me is when we begin talking about individuals as falling into different diagnostic bins or categories, it almost inevitably creates a little bit of separation between us and them. Oh, you're depressed and I'm not. Well, no, depression is a common human experience. So I may not be experiencing the same thing that you are, but I've tasted it. We've all tasted it. I have a sense of perhaps what you're going through. And to view you as a diagnostic label almost inevitably puts some distance or barrier between me and you.
Yes. Well, that's very insightful, because we practice psychology the other way most of the times, at least I think from the schools and things like that. We separate people and their experiences from what we are experiencing.
Right. Well, here's the way I would more simply summarize that. My other complaint against, I'm more familiar with the Diagnostic and Statistical Manual put out by the American Psychiatric Association. So I don't know what diagnostic system you may be more familiar with, maybe the ICD put out by the World Health Organization. But in any event, almost all of those diagnostic systems have a tendency, what I would say is pathologizing normality.
Mm-hmm. Yeah.
I think it's more useful to normalize pathology.
Oh, okay. Yeah.
Turn that around.
Yes, yes, yes.
So the entire focus, I think, is off. It needs to be flipped around.
Mhm. Yeah, that will also some way erase the taboo and the other things. And
Exactly. And
yeah.
stigma and stereotyping.
Oh, yes.
Exactly.
So maybe saying that you are a different person with a different experience is what is causing the taboo and all the issues, maybe, right? Doctor, can we say that? This is one of the causes, yeah?
Well, I think part of
At
this
least
is
at least in our place, like, in our place, mental health is something that is growing up slowly, and there is a lot of taboo in India, especially when it comes to, you visiting a psychologist or something like this. I think it's because, they totally separate the experience of the person who is suffering from their experience. So if they can see that it's kind of similar, maybe, that can remove a lot of this type of, taboo and things like that.
well, yeah. Well, I think historically a lot of it goes back to kind of a disease model
Mhm.
that mental health issues is reflection of some underlying disease pathology of some sort. And so if one's diagnosable with a mental health condition, somehow that's reflective of a disease. So historically, it's been kind of a binary approach. So either you have the disease or you don't have the disease.
Mhm.
And so either you're ill or you're not ill, you're healthy or you're not healthy. So it sets up kind of a false dichotomy. And as I was saying earlier, I think it's more useful to think of this as being on a continuum. That certainly the emotional suffering that someone might be encountering who would legitimately be eligible, let's say, for a diagnosis of major depressive disorder,
Mm.
is not going through the same emotional suffering, hopefully, that you and I are. But I'm not sure I would argue it's a matter of degree or intensity or amount rather than kind.
Like, I was not thinking about discussing anxiety, but is anxiety also the same? I mean, like, anxiety
Absolutely.
disorder, something like that.
Yeah. Who hasn't experienced anxiety?
Yes. So
Um,
it's just about the intensity of it. It's a continuum, right?
well, yeah, right. I think it normalizes it. That
Hmm.
it's not like some people have anxiety and some people don't. We all have anxiety.
Yeah.
It's not that some people experience sadness and sorrow and grief and guilt and remorse and hopelessness and helplessness. We all do.
Yeah.
We may experience it to varying degrees and to varying degrees of intensity. And some of us may respond in more appropriate ways and functional ways when we encounter it. But
Mhm.
we're all going to encounter it. It's an inevitable part of the human condition.
Mhm.
You can't insulate yourself from it. Or if you do, it's probably not a life that's very much worth living anyway.
Yeah. Yeah. So, like, Doctor, what are the best tools that we can use to assess the degree of suffering or something of that sort, to assess how much he is suffering from, a person is suffering from depression or anxiety?
Well, there's a saying in ACT, or acceptance commitment therapy, that I think, if I'm giving appropriate credit here, I think I first remember Kelly Wilson saying this, and that's follow the pain, or in the case of depression, what I like to say is follow the sorrow,
Mhm.
because on the other side of that is value and meaning. We don't experience sorrow and profound sadness and a sense of loss surrounding things that are trivial and meaningless to us. So if we're feeling profound sorrow and a sense of loss, it's a reflection that something that's very important to us has been lost or compromised, taken from us. And if you have a life that's worth living, you're going to be experiencing meaningful losses as you go through it. It's inevitable. People you love may die unexpectedly. You may suffer other kinds of losses. You may have hopes and dreams that sadly you realize are never going to be fulfilled. Those are also losses. So it's not only the loss of experiences and individuals that you've already had in your life, it's the loss of possible futures. Gee, what I imagine for myself, I'm painfully realizing is not going to come to fruition. That's also a sense of loss. So if you have hopes and dreams and loves and people you're close to, you're going to inevitably experience loss. There's just no way around it. And I think that's the genesis of how we respond to that, how we carry that, how we deal or cope with that, I think is very critical. It's not the loss itself. It's how we deal with that, how we manage it, how we find a way to go on with our lives despite those setbacks.
So so assessment is something that is not very functional in helping. Do you think so?
Pardon?
Assessment, is it something that is functional or?
Well, I think assessment in the sense of trying to understand what that sense of loss is for the person.
Mm-hmm. So we are following the pain, not the symptoms, not measuring the symptoms.
Well, it does several things. Number one, it dignifies their suffering.
Mm-hmm.
Their suffering is a reflection of and a validation of some important loss that they've experienced. So it dignifies that suffering. It also points in a direction towards, so I like to think of it this way. That's kind of a validation piece. Validating the suffering. That your suffering is legitimate, it has meaning, it's a reflection of the fact that something very meaningful, important to you has been lost or compromised or threatened in some way. It dignifies that. That's a validation process. But knowing what that is, what those values are on the other side, it's like a two-sided coin. Right? You don't have love without hate. You don't have sorrow without happiness. Sorrow without joy. So you want to identify what's on the other side of that, because that points in a direction toward which the individual hopefully can begin to reorient some of their life. If you know what's important, that can provide kind of a guidepost in terms of activation. So I think the other key in helping people with depression is not just validating and dignifying their sorrow, but activation, getting them to move their lives in a direction that's congruent or consistent with what's meaningful or valuable to them. Mm-hmm. So, I don't know about your culture there, but it's very common here in the United States to find, for example, parents who lose a child, perhaps due to some tragic set of circumstances. I just saw on the news last week, for example, they had a clip of some parents here in the United States who are basically making it their mission to install different car seats in the passenger section of cars, so children who are riding in the back in car seats don't have those seats thrust back on them and find that they're being crushed. So they lost a 2-year-old son because they were in a car accident, and the father was driving the car, and when they had the collision, it thrust his seat back and crushed their young son. And so they're finding meaning in that loss by crusading, by lobbying, by trying to ensure that different safety standards are followed. So something like that doesn't happen to some other family. So that's just an example. Gee, what was their sorrow? We lost our child. That's a very profound loss. How do we find meaning in that? Well, we can at least try and ensure that we're going to not have that occur to any other family. So rather than drawing back from the world, they're moving forward in the world, but with kind of a mission or a purpose. But it's tied to that profound loss that they've experienced. Now, that's a rather dramatic example, but what I'm suggesting is the same kind of process is probably applicable to all of us.
Yeah. So, Doctor, like from your years of experience, if when a therapist is helping a person who's suffering from depression or anxiety, what should be the things that he should or she should keep in mind when she's going through this journey?
Well, the validation process that I spoke of,
Yes.
I was primarily talking about that in terms of trying to assist someone who's experiencing depression or anxiety. But it also applies to the person themselves who's experiencing that emotional suffering. So, for example, I think the way that plays it out is in terms of self-compassion. So understand that if you're struggling with anxiety or depression, it's not a reflection that something's wrong with you, that you're broken, that you're diseased, that you need to be fixed in some way. Can you allow yourself a little understanding and compassion that what you're experiencing is an inevitable part of being a human being? There's nothing wrong with you. In some fundamental way, I don't believe there's anything wrong with someone who's clinically depressed. Are they experiencing a great deal of suffering? Obviously. But let's not add to it by kind of self-condemnation or self-criticism, not being kind to oneself, being critical of oneself for having that experience.
Yeah. So validation is the key when it comes to a therapist dealing with, and also validation is the key when it
on the
comes
part
to
of other people, but also self-validation.
yes, self-validation. Self-validation of the therapist or self-validation of the person who's suffering? You were talking about the self-validation of the person who is suffering, right?
Right.
Yes. And even when it comes to when we are making this journey with people who are suffering from depression and anxiety, the therapist also goes through a lot of feelings of ineffectiveness. Or do you hear about that? And what should a person do? Because this is a journey which has a lot of highs and lows, and
Oh, absolutely. There's gonna be bumps in the road, and that's to be expected. That doesn't mean that maybe the approach that's being taken ultimately may not be a useful one. So I think then the question becomes, well, when you experience those setbacks or bumps in the road, how do you respond to that? Well, that's just another challenge, and those are also almost going to be inevitable. Doesn't mean that perhaps the path that you're taking is the incorrect one, or not one that's ultimately going to be useful. There's going to be twists and turns. So how do you handle that? How do you respond to that? And there's we sort of talk about this way. It's to be expected that you're going to fall into a hole. You're going to end up in the ditch. The issue is, what do you do when you find yourself in that hole or in the ditch?
Yeah.
Are you able to get back out of that
and go forward? Yeah. Mm-hmm.
Which is the activation part.
Yes.
This is the activation part. You got to keep moving.
Mm-hmm.
Doesn't have to be big steps, But what's most important is that there's some movement in that direction, regardless of how small it might be. So sometimes I'll even say to depressed clients I'm working with, what's the smallest thing you could do today? Not the biggest thing. Because when you frame things as the biggest things, that may seem so overwhelming and daunting that you feel defeated before even embarking upon it. So pick something that's very small. And so sometimes I'll even say to clients, no, that's too big. Pick something smaller. Pick something smaller that you could do today that would move you in the direction of what you want your life to be about.
Doctor, when should we think about medicines? How much of a role medication plays in treating depression and anxiety, and when should a therapist, often we are referred cases, so when should we direct the person to a psychiatrist for medicines or something of that sort?
Well, yeah, I mean, I think that needs to be addressed very much on a case-by-case basis, individual by individual basis. And so I think the question is, what's the purpose? What benefits? What are the costs of well, really any kind of treatment, but that also certainly applies to medications. Insofar as there may be costs involved, certain medications have side effects in some cases, which may be rather difficult for individuals to deal with. So I think the question really is, in terms of the framework I've outlined, my question is, does medication in this case, is that an asset? Does that help facilitate what we're trying to accomplish in terms of sort of the framework we've been talking about, or does it not? And I've seen cases where it works both ways. So there's certainly some clients I've seen who struggle with depression where I think the use of medication has really played an integral part in facilitating the psychotherapeutic work we were doing together. I have to tell you also, however, I've seen other instances where I think the use of medication has been more of a detriment. In the sense that it did not help facilitate activation.
Yeah, understood. Yes, doctor. So,
and in those instances, it really is kind of counterproductive, at least within the therapeutic approach that I've sort of been talking about. So I think that, from my perspective as a psychotherapist, as a psychologist, who I can't prescribe medication, but I certainly recognize that medication may be an important asset, but I also recognize in some cases, I think it can be more of a detriment. So I think it really comes down to an individual by individual basis, trying to understand, how is this medication helping you? What's the impact of this medication? Is it more beneficial, or is it perhaps less beneficial? So, for example, outside of depression, we know from research that if you're dealing with individuals who have fairly well identified anxiety type disorders, things like phobias, agoraphobia, certain cases of OCD, and so on, as opposed to, let's say, generalized anxiety disorder, which is kind of more disconnected, that uses of medication actually can be counterproductive, and it lessens the therapeutic impact of the kinds of psychotherapeutic approaches you want to take to try and address those issues, which is largely exposure-based.
Yeah.
So there's research evidence that they're counterproductive, that if you're doing exposure-based kinds of therapies for people who are experiencing anxiety, they tend to respond actually better in the long run if their use of medication is much less. They're much less reliant upon medication in trying to deal and cope with their anxiety-related concerns than those who are less reliant upon medication.
Understood. Understood. And I think we are reaching the, I mean, like it's, the time we have allotted me is about to finish. So, like, I would like to ask you a final question. Like, we have a lot of, parents and siblings and friends, who know people who are depressed, and the people who are facing clinical depression, and this is a question that came up when we told people about this conversation we are having. They were asking, how can a layman, their friend or a mother or a father or someone of that, a colleague or someone, can help a person who is suffering from depression or anxiety? What should the person keep in mind?
Well, again, shared experience.
Yeah.
That some of the same emotional experiences that they're struggling with are probably ones that you have some familiarity with. So I think that's an important part. So we talked about self-compassion, being compassionate, validating their experience. I may not know exactly what you're going through, but I think I may have experienced some of the same kind of emotions. Having them, encouraging them to express those emotions, talk about them. This is not something to be ashamed about. This is something to be validated, to be understood.
Yeah.
See, help me understand what's so upsetting to you. Help me understand what's creating so much stress for you. Help me understand why you seem to be so sad. I want to be able to help. It might be easier for me to do that if I can have a better understanding as to what this is about. Will you share that with me?
Yeah.
So I think having a conversation that's validating, and as I was saying earlier, if you can have that, then I think you can begin to understand what's on the other side of that. So I can understand why you're so sad. Some hopes and dreams that you had now seem like they're not going to occur for you, or you've suffered a terrible loss. That must be very, very painful. Let's see how you can dignify your loss.
Yeah.
What can we do? Again, it comes back to that question. So it's the same question that I was suggesting that I might ask as a therapist is the same kind of question a best friend or family member can ask. So what could we do today?
Yeah.
What's the smallest thing I could help you do today that would move your life in that direction? What's important to you? I want to help you do something that gives your life meaning and importance.
Do you think
what is it that I can help you with?
Yeah. Doctor, do you think that validation sometimes, backfires a little bit, as in when we say that we...
Validation backfires if you don't have the activation.
Okay.
That's why they go together.
Okay. Yes.
And it's not just activation, because if you just have activation, then oftentimes the person's going to feel that they're being bullied, they're being put upon, and the person who's doing that really doesn't truly understand what they're experiencing. So I think it's absolutely essential that they go together. Validation by itself is not particularly useful, nor is activation by itself. They go together.
Understood, Doctor. Doctor, thank you so much for spending this time with us and having this.
Well, thank you very much for inviting me, and hope this will maybe be of some use to you and also the people that you work with.